Among those is the old spectre of prescription charges is being raised again. They look set to go up this time.
Yes, the proposal is to increase them from £3.85 to £5.
Well, that's in line with England, is it?
Nowhere close to being in line
That's
with
it.
England.
The upper end, sorry, is up with England, isn't it?
No, England is £8.85 in terms of their prescription charge.
Which they've just raised.
Yes.
But we're still some way off.
We're 75% cheaper.
The point is, though, that this is something which you stood up in Tynwald when you weren't minister and fought against, albeit a lesser rise, but a rise nonetheless.
Actually, that's incorrect. I have never stood up in Tynwald and argued against the prescription charges. I saw a few news articles yesterday, which I must say I chuckled at, because the reference that's being made to is actually when I was minister and a statement I made to the January Tynwald at question time. What I said was that I was withdrawing the proposed scheme that was on the table. That was if you go back to the Hansard, and that's the wonderful thing with having a Hansard, you can actually go and see what people actually said. What I said was that I was withdrawing the scheme. The scheme that was proposed was proposing that the age exemption go to 75, that all the other exemptions, including health exemptions, we basically take a hatchet at. And that was what, when I was a backbencher, I argued against, because the answer I got back when I asked as a backbencher why the age exemption was being set at 75 was that it was being linked to when you received a free TV licence, which I felt was ludicrous. That was what I stated in Tynwald, that we were withdrawing the proposals off the table to be reconsidered and re-looked at, and that's exactly what we've done, and these are the proposals that have now come forward.
So rather than axing the idea of prescription charges, you simply withdrew the idea to have a look at, and now you're bringing it back.
Yes.
How's this going to sit with people who thought they were out of the woods?
Well, I don't know quite what you mean by people who thought they were out of the woods.
The impression at the time very much seemed to be that this was an idea which would go when the old minister went.
Well, I don't know where you've got that from. I think the biggest concern amongst members was around the idea that you were going to remove the exemptions. Let's put some reality around this. In terms of prescription charges were last raised on the 1st of September 2010. It's been 7.5 years since the amount raised by prescription charges has been properly considered by Tynwald. There's also within there as well the fact that we are keeping the exemptions in place. So people with chronic conditions, people with diabetes, etc., will not be paying for their prescriptions, who were under what was proposed previously going to end up having to pay. So 90% of all prescriptions that are issued will remain free.
And there's good news too for people who are still in receipt of eye tests now.
There is. I think basically what we've come back with is a fair scheme. I think it's radically different to what was originally proposed. The bits that I, as a backbencher, was dead against, which was the age exemption rising to 75, and as I say, for some strange reason, the reason being given that it was being linked to free TV licences, and the fact that we were basically just going to take a hatchet to exemptions and say to people who in some cases had chronic conditions or people who suffered from diabetes, no, you will start paying for your prescriptions. That has all gone by the wayside, and I'm delighted that it has.
Have you had much feedback on it so far? Because, of course, part of it did form a public consultation last year.
It did, and obviously the consultation results were published, I think, not long after I became minister. I think it was one of the first things published under my ministerialship. And to be honest, the comments in the public consultation, the vast majority of them tied in with my feelings at the time, where people thought that what was being proposed in the original consultation was ludicrous. Those have been taken on board, and this is what's now come back.